If you've been experiencing pain on the front side of your shin, you might be having shin splints or medial tibial stress syndrome. Super common in people who have been not working out for long periods of time and then all of a sudden jump into activities. People who work out on hard surfaces such as tennis, basketball, track and field. If you're getting that constant pounding into the front part of the shin, your tibia might not be used to that type of stress. So it's causing shin splints. I'm going to show you in this video how you can use a foam roller to relieve that tension and pulling on the shin to help yourself relieve your pain from shin splints. So in order to do this, we're going to need a foam roller and somewhere to foam roll. My name is Dr. Jordan Fairley, and as a long distance runner, as a track and field athlete through high school and college and post-collegiately, I've seen this over and over with so many people. And now as a doctor of chiropractic, I use this method showing my patients how they can help themselves. So grab your foam roller. What we're going to start to do first is roll out the back side of your leg. So your calf muscle. Your calf muscle, when it gets super tight, it'll pull along the inside portion of your tibia or your shin bone. The tighter these calves get, the more it pulls onto your tibia, and so it can aid in this tensioning and pulling and contribute to shin splints. We also have the anterior muscle group on the front side of our leg here, so we can roll that out as well, so we can get both sides affected, so we're not pulling constantly on the front side and the outside portion of your shin. So let's start with the calf first. Here, what you can do is place weight on top of that involved side leg, lift your body weight up, take a huge breath in, creating pressure in your belly, so you're helping to stabilize your spine. And then let's twist our body weight more towards the inside portion of your leg, right there along the tibia. So in this position, you can roll up towards your knee along that insertion point where you have all that tight connective tissue that runs from your calf into the front part of the shin, and you can come back up, going all the way down to that medial malleolus, that inside ankle bone. In this position, find a spot that's super tight. Just right there, you can add some compression down with your heel, or you can have a super friend. So this is somebody who loves and cares about you so much that they want to see you get better and relieve your shin splints, where they can apply pressure downward with their hand to help you break up those tight muscle fibers. Either way, let's find that tight spot, add compression, and then we can do what I call a pin and stretch. So you're adding that compression, you're holding still, but then you're bringing your toes up towards your knee. So you're dorsiflexing and plantar flexing your foot, so you're lengthening those muscle fibers along the inside portion of your shin, and then you can move to a different spot, break up those tight muscle fibers, and then as you do this, you're literally breaking up some of that myofascia connective tissue, which is pulling on the inside portion of your tibia. Now let's work our way onto the outside portion of the front part of your leg. So here, I'm going to switch to this leg. You're going to go right along the front part of that outside part of your leg. So right above your lateral malleolus and your hard shin bone. Directly between these two, you have your anterior tibialis. I'm going to place that foam roller right on top of that spot, like so. In this position, I'm going to take that huge breath in, make sure my low back's not rounding or sagging, and then here I can roll up towards my knee. Ooh boy, that is tight. And then again, rolling up and down, finding some tight tender spots, and then if you want to do that pin and stretch, you can bring your toe up and plantar flex down. As I plantar flex down, so when I point my toes, now this is the side that's actually going to be lengthening. So pinning and stretching, I can relieve that tension in my foot, move to a different spot. If you want to add more compression because you're super brave, you can have a super friend, or you can put your weight on top of that other foot and then also plantar flex that foot, pinning and stretching on the front side there. So that is how you can use a foam roller to relieve shin splint type pain. So if you're just starting out working out again, I highly encourage you to do various things such as run on softer surfaces, make sure you're stretching your calf and foam rolling this backside and front side of the shin bone to help yourself with shin splints. I hope you found this video extremely useful. Please share it with your friends, your teammates, your colleagues, anybody who might be having shin splint type pain. And if you have any questions or comments, leave them below. I look forward to catching up with y'all soon and sharing in the next video.